The thing that makes Washington innovative is first that we're doing anything, but second that we're utilizing, sorry, but true. But second that our program is evidence-based. So the central element, it was mentioned before, we call it T-Care. It's basically a tailored caregiving program so that when people need help and they come into our system, we can do an initial screen to identify what kinds of support we can give them.
A lot of people, Kevin, are wondering what is the state's role? Because the federal government, when you talk about when you spend down your estate to nothing, then that kicks in. But what is the state's role? Because right now it's being met through a patchwork. You've got hospice, you have a lot of nonprofits, you have federal, you have state. What is the state's role?
The social services math overall.
Yeah.
So typical social service program, this is probably true in most states. In our state, it's about $12 billion every 2 years. And in our state, we spend about $2 billion on developmental disabilities, $2 billion on economic services, $2 billion on mental health, $1 billion on children, half a billion on juvenile justice, and $3.6 billion on long-term care. So long-term care, and it's probably true of every state, is probably twice as big as any other program. And maybe through long-term care, where we're spending $3.6 billion every 2 years, maybe we support 60 or 70,000 families. So 60 or 70,000 the state's supporting, and 850,000 are being supported really by their family caregivers. Then for this 1% that we are directly helping now, we're spending about $13 million.
If you could wave a magic wand, I know you don't write the policy, you just carry it out. What do you think is the biggest broken part of the system right now, and what should we do to fix it?
We don't have a great system of adult protective care in our state. It takes too long to respond, too much of a backlog. So my magic wand in this one area is focused on that issue. It's not a whole lot different than child protective services, right. Adult protective services, and we've done a really good job, or a much, much better job in child protective services in this state, but we're not doing a good enough job with adult protective services. It's the one area of our system where we're really falling down big time in long-term support.